Committee will come to order. I'd like to begin this hearing by stating the Oversight mission statement. We exist to secure two fundamental principles. First, Americans have the right to know the money Washington takes from them is well spent. And second, Americans deserve an efficient, effective government that works for them. Our duty on the Oversight and Government Reform Committee is to protect these rights. Our solemn responsibility is to hold government accountable to taxpayers because taxpayers have the right to know what they get from their government. We will work tirelessly in partnership with citizen watchdogs to deliver the facts to the American people and bring genuine reform to the Federal bureaucracy. This is the mission of the Oversight and Government Reform Committee. Social Security Administration oversees two large Federal disability programs, Social Security Disability Insurance Program and the Supplemental Security Income Program, both of which have grown rapidly over the last 25 years. The growth in these programs is a significant threat to the truly disabled who are often pushed to the back of the line and who face large benefit cuts in the future if the program is not reformed and reformed quickly. The rapid growth in these programs corresponds to a period of time when the typical job became less physically intensive and the health of Americans nearing retirement improved. The consensus of expert academics and researchers from across the political spectrum attributes a large portion of the growth of the program to a slower economy and a more subjective criteria for entry. In June, this subcommittee held its first oversight hearing related to the Social Security Administration's management of these programs. At that hearing, the committee heard testimony from two former and two current Social Security Administrative Law judges. Their testimony revealed significant problems in the Social Security appeals process, an avenue by which more than 300,000 applicants typically gain access to the program each year. One overarching theme of the testimony was that the agency's push to reduce the backlog had an unintended consequence of judges putting too many people onto the program who were able to get back to work. In subsequent months, committee staff received numerous briefings from agency officials and conducted 3 transcribed interviews with Social Security Administration law judges. The committee has learned that some judges employ shortcuts and do not consider all the evidence available prior to reversing a previous decision. It is important to emphasize that disability cases typically only reach ALJs after applicants have been denied twice at the local disability determination level. Moreover, for all practical purposes, an ALJ decision to allow benefits is irrevocable commitment of taxpayer funds, since favorable decisions are not appealed and less than 1% of disability beneficiaries ever return to the workforce. The committee's most recent transcribed interviews with the Regional Chief Administrative Law Judge for Region 3, Jasper Bede. Judge Bede testified that if a judge's reversal rate is anything over 75% to 80%, or the judge disposes of more than 700 cases in a year, it raises a red flag that the judge may be issuing poor quality decisions. 2 other judges interviewed by the committee testified that judges who decide over 700 cases a year are not doing a thorough job in evaluating all the evidence. The committee obtained Social Security adjudication data back to 2005. Some simple statistics indicate a substantial problem. For instance, between 2005 and 2012, more than 930,000 individuals were approved for benefits by a judge with an approval rate in excess of 80%. In fact, more than a third of the agency's judges have approved more than 80% of applicants in at least 1 year. Between 2005 and 2012, nearly 500,000 individuals were approved for benefits by a judge who disposed of more than 700 cases in a year. During his interview, Judge Bede singled out 7 judges in Region 3 whose disposition data was indicative of a problem with their decision-making. But Judge Bede also testified that he was powerless to do anything with these judges because of agency policies and management. These problems raised 3 important questions. Did the agency fail to stop red flag judges because the agency's focus on processing as many cases as possible? Who has been held responsible for allowing hundreds of judges to essentially rubber stamp people on the program for years? Will the agency prioritize continuing disability reviews, CDRs, for individuals who have gained access to the program because of one of these judges? In addition to prioritizing medical CDRs for individuals approved by red flag judges, the agency should immediately suspend several judges and conduct a review of their decisions and practices. While some reforms to correct the broken disability determination process will need congressional action, there are many steps the agency can unilaterally take to better protect American tax dollars and those most in need. Unfortunately, the agency is moving very slowly to adopt needed changes and to clarify perverse regulations. The decision grid has not been significantly revised since the 1970s. Although hearings are non-adversarial, the agency has not required that claimants and their representatives submit all evidence, favorable and unfavorable, in advance. Moreover, it should not take the agency more than 4 months to reply to questions for the record to this committee as it did for this last hearing. I hope today's hearing will provide the committee with some clarity about the agency's plan to move forward and, quite frankly, what we in Congress can do to help in that process. Social Security disability serves the most vulnerable in our nation, and the individuals that are sitting in front of me have committed their life to protecting those individuals and helping in any way that we can, and we are grateful for your service. And we are hopeful that this conversation today can be a conversation on how we can continue to protect those most vulnerable. But we cannot ignore glaring issues that are driving this program into insolvency. If we do not aggressively deal with the fraud, costly mistakes, and legislative fixes required, we will see those in greatest need put in tremendous risk. I believe it is time to fix this system, and we intend to work with this administration in a bipartisan way to prioritize those solutions today. With that, I would like to recognize the very not feeling good ranking member from California, Mrs. Spear.
Mr. Chairman, thank you. Thank you for holding this hearing. Thank you to all the witnesses for participating. And I want to commend the Chairman for not suffering from attention deficit disorder, which is typically what happens here, where you take an issue on, you have one hearing, and you go away. You're sticking to it. I'm proud that you are, and as a partner, I want to make sure we fix this as well. Having said that, disability insurance benefits are a lifeline, a true lifeline for millions of Americans who can no longer work in any capacity because of a serious disability. This is a benefit that American employees pay for, and we need to remember that, through their FICA taxes. While the number of applicants and beneficiaries have increased over the past several years, this is an increase that was projected more than 20 years ago as a result of my generation of baby boomers that have become more susceptible to disabilities as they have aged, and the fact that there are an increasing number of women in the workforce. Every program needs vigorous oversight and strong policies in place to prevent waste, fraud, and abuse. Again, I commend the Chairman for focusing on this issue. But it's also important to note that the Social Security Administration has initiated significant efforts to improve management oversight and accountability for the disability adjudication and review process, particularly since we last met. For instance, the agency is reviewing the quality of ALJ decisions to ensure their legal sufficiency, and the Appeals Council reviews ALJ's decisions and provides useful feedback to individual ALJs regarding the quality of their decisions and to the agency regarding its policy guidance. The recently created Division of Quality conducts reviews of ALJ award decisions before the benefits go out and conducts discretionary reviews of denial decisions. These reviews help ensure the quality of ALJ decisions and allow the agency to do a focused review of specific issues related to the hearing process at a hearing office or with a specific ALJ. In addition, SSA has initiated efforts to address concerns raised by ALJs and others regarding some disability adjudication and review policies. For instance, the SSA has noticed a proposed rulemaking that require a claimant to submit all evidence that relates to their disability claim in a timely manner. This regulation will enhance the accuracy of disability determination and address the concerns that some claimants or their representatives are withholding evidence that may not be favorable to their claims. The fact is that the national allowance rates have gone down since 2008 from 61% to 47%, its lowest rate since the 1990s. It's important to ensure that these determinations are done fairly and thoroughly. But it is equally important to ensure that ongoing benefits are proper. And let me emphasize this. Continuing disability reviews, which are periodic reviews of disability awards to determine if the beneficiary continues to meet the disability criteria, are critical, and I underscore that, critical to the integrity of the system. Unfortunately, there are too few of them. These reviews are highly effective means for reducing overpayments or identifying fraud. We know that the system is at a tipping point. We do not want to see these benefits reduced for those who legitimately should be receiving Social Security disability. So if we actually focus in on CDRs, we can save money and make sure that those who deserve these benefits receive it. In fact, for every dollar spent on CDRs yields $9 in program savings. According to the IG, SSA could have avoided paying $556 million in 2011 if they had just performed medical CDRs in the backlog when they were due. So it is more than troubling to hear that there is 1.3 million backlog of scheduled CDRs this year. It borders on outrageous to learn that these benefits are still being paid to some who have died or who have been incarcerated. Let's be clear, this is partly Congress's fault. Funding for the SSA has fallen dramatically in the past 2 fiscal years. It is up to Congress to provide the funding the agency needs to fulfill its mandate to effectively monitor program integrity and save taxpayer dollars. I hope my Chair and colleagues would agree that given the clear cost-benefit analysis provided by the Inspector General, we should ensure that the agency has sufficient funds to conduct all of its scheduled CDRs and continue other program improvements that have allowed it to reduce its backlogs and increase efficiencies while improving program integrity. But even in the context of overall improvement, there clearly is still abuse of the system by some bad actors. A recent investigation conducted by the U.S. Senate Homeland Security and Government Affairs Committee and the Senate Permanent Subcommittee on Investigations identified evidence related to a scheme to defraud SSA implicating a law firm, an ALJ in Huntington, West Virginia, and doctors. As Senator Tom Carper, Chairman of the committee, stated, quote, "While we don't have any evidence that this is more than an isolated case, one example of inappropriate action of this nature is one too many," unquote. I look forward to hearing from our witnesses on how we can work together to continue this trend of improvement.
Thank you. Members will have 7 days to submit opening statements for the record. We will now recognize our panel today. Patrick O'Carroll, Jr. is the Inspector General of the Social Security Administration. Thank you for being here. Mr. Gene Sklar is the Deputy Commissioner for Disability Adjudication and Review for Social Security Administration. You have a return engagement from being here, and so I appreciate you being here again. Judge Jasper Beed is the Regional Chief, Administrative Law Judge for Region 3, Office of Disability Adjudication and Review of the Social Security Administration. Thank you for being here. Mariana Lacanfora, is that right? Is the Acting Deputy Commissioner for Retirement and Disability Policy of the Social Security Administration. Ms. Lacanfora is not testifying today, but is, as far as an opening statement, but is open to doing questioning. So, pursuant to that, as far as answering questions as well, we swear in all witnesses according to committee rules. If you please stand, raise your right hand. Do you solemnly swear or affirm that the testimony you are about to give will be the truth, the whole truth, and nothing but the truth, so help you God? Thank you. You may be seated. Let the record reflect the witnesses have all answered in the affirmative. In order to allow time for discussion, I am going to ask you to limit your testimony to 5 minutes. You will see a little clock in front of you that will take down from 5 to 0, and you will see a little red light that comes on when you get to 0. We would like it to be as close as possible. We will have a little bit of leniency, but we would like to have plenty of opportunity for questions as we go through this. With that, Mr. Carroll, I would recognize you first for opening statement.
Good morning, Chairman Lankford, Ranking Member Speer, and members of the subcommittee. This fiscal year, SSA projects that it will pay about $190 billion to 18 million disabled workers, their dependents, and to disabled SSI recipients, and receive about 3 million new disability claims. Determining who is eligible for benefits and who continues to be eligible is an overwhelming task. My office has spent over 18 years conducting audits and investigations aimed at helping SSA perform this duty as quickly, carefully, and accurately as possible. Looking first to those already receiving benefits, my office has long urged SSA to conduct more continuing disability reviews, or CDRs, and more SSI redeterminations. We consistently encourage Congress to fund these critical reviews. With a return on investment of 9-to-1, appropriations for these reviews are a sound fiscal policy. After dedicated funding ended in 2002, CDRs and SSI redeterminations declined over 60%, creating a significant backlog. While SSA has been conducting more reviews since 2009, the backlog has nevertheless continued to grow. As a result, SSA continues to make payments that could be avoided. For example, according to past audit work, about $3.3 billion in SSI payments could have been avoided in just a 2-year period, and up to $1.1 billion in disability benefits could have been avoided in 2011 alone. The OIG doesn't merely focus on CDRs and redetermination. We provide sound reasons for funding and conducting them. For example, in a recent review, we found that SSA hadn't conducted 79% of childhood CDRs and 10% of age 18 redeterminations within the timeframes required by law. With the cost over 4 years was $1.4 billion. Payments made because of delayed reviews of current beneficiaries are troubling because they are largely avoidable. But payments made to people who should never have been awarded benefits at all is equally troubling. We focus closely on the Office of Disability Adjudication and Review and Administrative Law Judges in our audit work to help SSA ensure that undeserving applicants do not receive disability benefits. For example, we recently issued a report on risk factors at hearing offices, and we found that while ODAR had created 19 separate ranking reports that measured hearing office performance using individual risk factors, it had not combined these risk factors to better identify problem areas. As a result of that, we are conducting an audit that does just that. We believe the new model that analyzes multiple risk factors will help to identify outlier offices, as well as hearing offices with best practices that can be emulated. My written statement identifies more audits planned for fiscal year 2004 and beyond, all aimed at helping ODAR continue to improve the timeliness and accuracy of its decision-making. I would be remiss, however, if I did not point out that disability fraud is the issue my office confronts on a daily basis. Individuals committing disability fraud is disturbing enough, but doctors, lawyers, and other third parties who facilitate fraud for scores or hundreds of beneficiaries is intolerable. Our recent operation in Puerto Rico illustrates how a handful of facilitators can put many ineligible people on the disability rolls, and our work in the Commonwealth isn't finished. Nor is our work elsewhere, as you might have seen in recent news headlines and stories. While I can't discuss these open cases, I can tell you they both remain very much active. Moreover, in July, we launched a disability fraud pilot. Its sole mission is to identify, investigate, and prosecute doctors, lawyers, interpreters, and others who commit large-scale fraud. Meanwhile, our long-standing and highly successful Cooperative Disability Investigations, or CDI units, continue to try and identify fraudulent applications before benefits are ever paid. Since the program was established in 1998, CDI work nationwide has resulted in projected savings of $2.5 billion. I'm happy to discuss the CDI program in more detail today if you have any questions. Through our audit and investigative work, our disability fraud pilot, and our CDI units will keep working with SSA and the subcommittee to improve the disability programs and to reduce fraud, waste, and abuse. I thank you again for this opportunity to testify, and I'll be happy to answer any questions.
Thank you. Director Sklar.
Chairman Lankford, Ranking Member Speer, and members of the subcommittee, my name is Glenn Sklar, and I'm the Deputy Commissioner for the Office of Disability Adjudication and Review. In this capacity, I oversee SSA's Hearings and Appeals operation. It has been my honor to serve for over 22 years in an agency where our mission affects nearly every American. From my start at Social Security as one of the founding members of Social Security's Office of Inspector General, to my time working as a top executive with the quality component, to my current role leading the Hearings and Appeals operation, I've done my best to balance the demands of delivering high-quality work in a high-volume public service environment. With me today is Jasper Bede, the Regional Chief Administrative Law Judge in the Philadelphia region, as well as Mariana Lacanfora, Acting Deputy Commissioner for the Office of Retirement and Disability Policy. When I came to the Hearings and Appeals operation in 2010, I found an organization that was in transition. In 2007, Congress had made it abundantly clear that we were morally responsible for getting timely answers to Americans whose lives hung in the balance. Some claimants were waiting as long as 1,400 days for an answer. Our hearing operation has made and continues to make significant and substantial progress in addressing the quality, accountability, and timeliness of our hearing decisions. We have steadily reduced the average wait time for a hearing decision from a high of 512 days in fiscal year 2007 to just 375 days in fiscal year 2013. This progress was made while handling a staggering 800,000 requests for hearing annually. My repeated message to our employees is that we are accountable for providing quality decisions, meaning timely, policy-compliant, legally sufficient, and factually accurate decisions. To help our employees meet that expectation, we've improved our hiring processes, updated how we train, developed tools to give judges policy feedback, established a division of quality, and begun collecting and analyzing data, mountains of data, to truly measure how we were doing. We have capped the number of cases an ALJ may be assigned to clearly signal that more than speed matters. Data, not supposition, show that we have closed loopholes and improved feedback and consistency. For denial decisions, we've seen increasing concordance between ALJ decisions and the Appeals Council. We have increasing amounts of data to detect areas of noncompliance on allowances, and we're using that data to provide better feedback to our decision makers. Our ALJs have qualified decisional independence to enhance public confidence in the fairness of our process and to ensure that ALJs issue decisions free from pressure to reach a particular result. ALJs must, however, be consistent with the law and agency policy. In addition, we have successfully tested our authority to manage ALJs and hold them accountable in cases brought to the Merit Systems Protection Board. Fortunately, most ALJs want feedback and information that will help them accomplish the dual responsibilities of timeliness and quality. To help our ALJs, we are taking a number of steps, such as emphasizing the need for policy compliance, providing quarterly training on difficult topics and annual training for a significant percentage of ALJs, giving ALJs access to real-time data that highlight where they might be making mistakes and encouraging them to self-correct, and standardizing the electronic business process and developing an electronic bench book to help judges work electronically. We also established a division of quality that reviews a statistically valid sample of favorable determinations for accuracy and policy compliance before the money goes out the door. We've reduced the maximum number of cases that we assign to our ALJs each year to 840 cases per ALJ. And we started collecting and analyzing data to determine how we can make the hearings and appeals process better. Making disability decisions for Social Security is a challenging and complex task. I am proud of our ALJs who rise to the challenge every day. Thank you for inviting me here today, and I stand ready to answer any questions you might have.
Thank you. Mr. Beat.
Chairman Lankford, Ranking Member Spear, and members of the subcommittee, my name is
Sorry to interrupt you. Could you pull your microphone a little bit closer to you there?
Is that better? Okay. Again, Chairman Lankford, Ranking Member Spear, and members of the subcommittee. My name is Jasper J. Bead. I serve as the Chief Administrative Law Judge for Region 3, the Philadelphia region. I have been in this position with the Social Security Administration since April of 2006. Prior to that, I served as the Hearing Office Chief Administrative Law Judge in the Wilkes-Barre, Pennsylvania Hearing Office from 2002 to 2006. I was appointed to the position of Administrative Law Judge in 1999 after working in the Social Security Administration as an appeals officer, supervisory attorney advisor, and an attorney advisor. Prior to my service with the Social Security Administration, I served as an officer in the United States Army. Region 3 includes Delaware, the District of Columbia, Maryland, Pennsylvania, Virginia, and West Virginia. The population we serve in Region 3 is a reflection of the wider population of the United States. We serve clients from farm laborers and coal miners to medical researchers and software designers. Many of the claimants who appear before our judges have unskilled work backgrounds and less than a high school education. However, we also see claimants who have achieved the highest level of education and worked in the most skilled professions. Region 3 has 18 hearing offices, 150 administrative law judges, and approximately currently 742 support staff. Our pending caseload is now over 99,000 cases, and in fiscal year 2013, we closed 80,753 cases, with an average processing time of 407 days. Region 3 ranks as first in the nation in quality measures with an average 87.7% Appeals Council agree rate. And we also have the first and second ranked hearing offices in the nation in our Johnstown, Pennsylvania, and Seven Fields, Pennsylvania Hearing Office. As the Chief ALJ of Region 3, my job is to make our offices best serve the claimants and contribute to ODAR's mission of providing timely and quality service to the public. I frequently visit hearing offices in my region and emphasize our goals of providing timely, policy-compliant decisions. I set up one-on-one meetings with our new ALJs, any new ALJs in my region, and I make myself available to all staff. With regard to the ALJs, if I learn of an issue, I work with the hearing office chief administrative law judge to discuss the issues and assist the affected administrative law judge. If informal discussions with the ALJ do not correct the problem, I may counsel the ALJ or issue a formal reprimand. For more serious issues, I can request that the Chief ALJ initiate proceedings with the Merit Systems Protection Board. Thank you for the opportunity to be here today, and I would be happy to answer any questions that you may have.
Thank you. We're going to do several rounds of questioning today. Our goal is that everyone will have about 5 minutes to be able to jump in on a round of questions, and then after that's concluded, we'll open it up to a broader conversation for all of us on that. Mr. Sklar, there's no question you walked into a situation in your leadership. We're grateful for your background, your experience. I've spoken to several people in multiple different regions across SSA, and they all have great respect for you. That's good word. So I'm grateful that you're there and in that position, but you're in this position to be a leader for the system, and we need a leader for the system. You see it full well. You've already taken actions into some of these things. So the push that we're going to have today is not personal to you at all. This predates you and your leadership by far, and there are issues that we need to deal with on this. We have several things that are all coming down on us. One is we've had a bottleneck of getting into the system with just a flood of people that have applied through both a generational shift and I would say also an openness that it appears it's easy to get on, and so even more people are trying to jump in the system just to test it and find out how easy it is to be able to get on. And the second part of this is the CDR reviews. Those reviews coming in, so we've got two bottlenecks on either side of this, and we're getting an awful lot of people into the middle of it and have to be able to process this. So I want to talk a couple of these things on it. Judge Beede, you had several high-performing, let's say, judges that were in your district on it. Judge Bridges, who, when we run the numbers on it, we just looked at the testimony that you gave to us, somewhere between 75 to 80%. If they're doing a reversal rate of that high, that should raise some sort of red flag. Would you still agree with that? If you've got an 80% reversal rate as a judge of reversing the two previous decisions?
Well, without being specific to Judge Bridges or any other administrative law judge, if we have reversal rates that high currently, that would raise some questions. It would be an indicator, but it wouldn't necessarily establish that the decisions being made are wrong. Each case has to be looked at individually. And it is possible to sit on the bench and find 45 people in a row are disabled, and then 2 weeks later find 25 people in a row are not disabled. Right. Because it's each individual case. But a very high production rate with a very high reversal rate or a very low reversal rate does raise some questions.
Yeah, our observation obviously is they've already been denied twice. We've had two folks that have gone through their files, that have looked through, that are on the state level trying to evaluate it. Then they go through this third process, and if they're reversing 80% of the time previous, there's either a problem on the previous side or there's a problem on the judge's side, but that seems like a very high percentage.
Since you chose a Pennsylvania judge.
Well, I can actually.
No, I just want to indicate.
No, let me just say this.
Pennsylvania, they would only be denied once.
Okay, that's good to know, actually.
Yeah.
But on several of these, when I go through it, we ran just from 2005 on. A typical case, once they're approved, is about $300,000 in lifetime benefits. And so we just tried to run through the actual cost. This is not a scientific number. This is a ballpark number. So Judge Bridges basically, since 2005, has approved about $4.5 billion in benefits. Judge Daughtry, 2005 to 2011, obviously, $2.5 billion. Judge Taylor, $2.5 billion. So we're dealing with very serious dollars on it. Not all of those are incorrect. I'm not trying to accuse that. but there are significant amounts that are moving into this. If we looked at all judges nationwide that did an 80% approval rating or higher, if we just took maybe even the 10, 15, almost 20% for some that are above 80%, we're still with about $100 billion that we have questions on to say this is a very high approval rating. And so a lot of our questions are just going to process through how is this happening either early in the process that they're being denied when they shouldn't be, and so it's become more difficult for someone who's truly disabled to get in the system, or how is it there's such a high reversal of that? Mr. Sklar, do you want to jump in on that at all, just a perspective?
Sure. Just to add a little bit of perspective, I would draw your attention to my written testimony, and there is a chart there, and I think you've seen that chart before. It may look a little bit different in that there's even fewer outliers on that chart than the last time I was before this committee.
Right.
And I think it is a fairly dramatic retrenchment of
There has been a significant change in the last couple of years, and we're grateful for that, just the attention to be paid to it.
I think so. I mean, if you look at it at a global level, some of the practices we put in place are really starting to have an impact. Even looking at the side chart, you notice the case cap coming into effect and biting down. It's about a 50% reduction on the number of cases that one particular ALJ was handling. It's tough. It's a very large system. It has variability in it. It's meant to. Judges have qualified decisional independence, drawing off congressional statute, the Administrative Procedures Act. So you do the best you can with the system you have, and we've tried to put in rational ideas in light of some of the constraints we have.
Okay. Yield to the ranking member.
Thank you, Mr. Chairman. Along the same lines, let me ask you, Mr. O'Carroll, do these appear to alarm you when you have those kinds of approval rates or reversals of decisions made in the states? And if they do, what steps should be taken to determine whether or not the quality of the decision has been accurate?
Ranking Member Speer, on those, again, probably where we started down the road with these was in 2008. We did an audit where we took a look at the hearing offices and the rates of the different offices on it. And at that time there, we were taking pretty much a look at the bell curve of it, and where the vast majority of decisions were being made, the numbers that were being done on it, and again, we were trying to give management information to ODAR that they could use in terms of what are the outliers on it. And again, when we're starting to take a look at the outliers that are doing a lot of approvals or a lot of denials, in both cases we wanted the quality reviews for ODAR to be taking a look at them for a couple of reasons. One is
actually, I have limited time, and I've got a lot of questions to ask you.
Okay.
So what should the quality review encompass?
Well, that should be taking a look at the encompassing on it. They can't target. That's the other issue because of judicial independence. You can't just say that we're going to take a look at every one of the hearings of this judge because they're at that level. What they can be doing is they can be taking a look at trends. They can be taking a look at high numbers or whatever and giving advice back. And we've asked them to do it, and they are doing it now. There's a quality review section that we work with at times to be, again, to find more information on the outliers.
All right. So you approve of the quality review
Yes.
that's going on right now.
I
Is there
do.
anything more that should be happening in that regard?
We said yes. We're telling them that there's about 19 things that they take a look at in terms of decisions. And what we're saying to them is that they ought to narrow it down to maybe 4 or 5 major ones on it and then be taking a look at that as again to help on picking out outliers. Because as it is now, it's like a large scoreboard. We're telling them to take a fewer number of them and take a look at those specific things.
Would you provide that to the committee, please?
Yes, I will.
All right. You referenced Puerto Rico. How did that come into focus for you? Was there a whistleblower, or was this something you just at some point decided to review?
I think Puerto Rico is a good example of government at its finest. What happened was with Puerto Rico, 2 things happened really. One was that in the DDS in Puerto Rico, the Disability Determination Center there, started noticing that they were getting the same type of diagnoses coming in on all the different people applying for benefits at the time coming from this one specific doctor. They brought it to our attention. We started taking a look at it, and pretty much at the same time period, the press was taking a look at which offices were doing very high, which states were coming up with very high allowances of disability. And that resulted in some media attention that was going on at the same time.
So okay, let me ask you this. when there has been, as you pointed out, billions of dollars of payments made inappropriately, when we then go back to try and get repayment or refund, what percentage of those individuals are in a capacity to refund, and do we put liens on their property? What do we do to get the money back that they had received inappropriately?
Well, there's a number of ways on it. One is that if it's criminal, we'll make it a decision of the court to pay it back. If it's civil, and we go in civil monetary penalties, if a person has resources, then we'll fine them, and we'll be asking for fines on top of whatever was paid incorrectly. SSA will then establish an overpayment on it, and that overpayment will be paid back if they have the resources on it, or if they don't have the resources on it, if they ever get any benefits in the future, it'll be taken away from any future benefits on it. As you can probably tell, Congresswoman, is that there's, a lot of the resources on these people here is
limited, right?
Limited.
So the likelihood
depends.
of getting repayments is not very good. So I guess I'm trying to look at ways of discouraging the fraudulent applicant from even coming forward.
We agree.
And whether it's a notice to them on the application that if in fact it is found that you are fraudulent in your actions here, that these are the kinds of things that you will be subject to, something to kind of scare them into not moving forward. And I'd love your thoughts on that at a later point, if you
Okay,
would.
because we believe, as with Puerto Rico, it's a good deterrent on it. And our also the belief is to stop it before they go out, in terms of what we have as the CDI units that I'll talk about later, to stop it before
So the
benefits are
CDRs,
given.
there's this huge backlog.
Yes.
How much money would we have to set aside so that these CDRs could be appropriately handled and save us $9 for every $1 we spend?
I'd have to get back to you on the exact amount of what it is. What we're asking for is them to be doing more than 500,000 CDRs a year. We'd like that to be doubled, and that would then have a better effect.
All right, maybe in a subsequent conversation we can ask Mr. Sklar how that might be achieved.
Can we go ahead and just do that right now, if that would be okay
Sure.
with you? Mr. Clark, do you know the number on that?
If I might respond.
We brought a technical expert with us. Thank you.
So in the fiscal year 14 President's budget, we have a request. We call it the Program Integrity Administrative Expense Proposal, and we're asking for $1.2 billion. If we were to get that money, we would be able to do just over 1 million medical CDRs.
And you project what kind of savings from that?
Oh, that I don't have off the top of my head, but I
Well,
can
if it's
get you that.
if it's $9 for every $1, we can basically make that case,
And it
correct?
could even be more than that.
Okay, your recommendation on this is 500,000. Y'all's request is a million.
No, I think we're saying.
No, I had said double.
Oh, okay.
Right. So this year we did almost 500,000.
Okay,
So.
got it. So it's an additional 500,000 then?
Right.
Okay.
Yes, Mr. Chairman.
Thank you. With that, I yield to Mr. Farenthold.
Thank you very much. And I'd like to follow up on the CDRs for a second as well. You said there's a huge backlog. Did I miss the number? Do we have the number that we need to be doing?
Yes, Congressman. 1.3 million is what the backlog is right now.
Okay, I just want to make sure I'd gotten that correctly. Now, Mr. O'Carroll, let me ask you this. So as you go through the CDR, you're finding folks who have either gotten better, but I mean, how many of these are fraudulent claims to begin with that you're looking at? I mean, is the money better spent looking at it after the fact, or is the money better spent kicking up the initial evaluation?
Very good question. What we feel is that, one, once they get on, it's very difficult to know whether they were disabled at the time that they got on. With the idea of the CDRs is to catch them, not catch, but to identify them if they have improved.
I'm good with catch, because if you're filing a fraudulent claim, you're ripping off the American people. I agree. I'm okay with catch, so go ahead.
Okay, good. But the other one, I guess, is it's easier, rather than letting the animal or the horses out of a barn and trying to catch them, our thought is to keep them in the barn or keep people from getting the benefits in the beginning if they are not entitled. And that's one of the reasons why we try to have our cooperative disability units, where if a person comes in purporting to have a disability on it, and the disability examiners find that this doesn't really, track correctly on it, they refer it to this unit, and then this unit will be taking a look at either a couple things. One is the, different types of records out there. So, for example, if a person's coming in saying that they're extremely sight impaired, and we take a look and we'll run information on motor vehicles and find out they have a commercial driver's license, I guess that's what we'd call a clue.
Right.
Other ones that we look at is also, it's sort of interesting, is we're now going to social media where a person comes in and says that they're incapable of, of walking or being in crowds, and we take a look at their Facebook page and it shows them in a band or a social group that's out there working all the time, or we have pictures of them doing other things.
Let's get back to the fraud in general. We talked about going and getting the money paid back and getting fines. Are the penalties a sufficient deterrent, or do we need to be looking at kicking up the penalties as well?
Congressman, I'd say that the penalties that are out there now for people committing fraud against the government are good. They are a good deterrent on it. The problem with it is getting the prosecutions for it. In our cases, what we're finding is it's very difficult to be able to show that much of a loss to government that a U.S. Attorney's Office would be interested in putting into all the resources that could take a person to trial.
And what about penalties for enablers that would be doctors or lawyers that continue to prosecute or authorize or document these claims?
The penalties are there. They're strict. And I got to tell you, on one good example that we're having, which has gotten a lot of publicity, is within Puerto Rico, where we had a bunch of doctors and others, that non-attorney reps and reps that were bringing people on. The U.S. Attorney's Office there, I was down there, met with the U.S. Attorney on it. She assures us that, one, that the penalties will be strict, that they're going to be enforced, and that there should be jail time involved. So I think that we're going to have a very good signal that's sent on that when they use the laws to enforce it.
All right, and again, some disabilities are or temporary in nature, can improve with medical treatment, or technology can improve to where that disability is not as disabling, I guess, as you will. Do you think there are adequate incentives within the system for a person to work whatever program, say their physical therapist gives them, or to continue treatment for whatever mental disorder? Or is there a sense, well, I'm on this for good, I don't have to work it, I'm getting a check in the mail?
Well, let's put it this way. I'd prefer the latter not be the word that's out there on the street, and that what we're hoping to do is send a signal is that if you have improved, you shouldn't be getting the benefit. And what we're trying to do with that, by the same token, and I got to say, as we monitor that, the SSA takes a look at what are the risks of, or not the risks, what are the success rates of different types of illnesses, et cetera, and then those are the ones that we're saying should be brought in for the CDRs.
I don't think any of us here want to deny benefits to somebody who need benefits, but we need to make sure that there's adequate resources to provide benefits for everyone who needs them, while still encouraging people to live a good and fulfilling life. I find that I'm a whole lot happier when I'm actually out doing something and not sitting at home. So I'll yield back. Thank you.
Mr. Duckworth.
Thank you, Mr. Chairman. The Social Security Disability Insurance and Security Income programs provide a critical lifeline that allows nearly 12 million severely disabled Americans the opportunity to live dignified lives. The benefits that they earn through this program are very modest, about $1,000, $1,100 a month, barely above at the poverty level. And they generally represent the majority of the income for the recipient. But knowing this, I want to make sure that people who don't deserve it are not getting it. So, Mr. O'Carroll, I'm sorry, in your audit, your office identified some issues regarding the termination of disability benefits following a CDR cessation determination. So even for the $500,000 that are being conducted and decisions that are being made, if the decision is that to remove the person from to terminate the benefits, I'd like to talk about how we go about doing that, and if you could talk a little bit about your recommendations for enhancing the ability of the processing system to perform, automated terminations and the like. Since we have a backlog and we're not doing quite enough, and when we finally do have a determination, are we actually following through?
What we're finding on that, Congressman Duckworth, is in our audit, we found about 30% of the time that a person was was identified as having improved and should have been ceased in terms of getting their benefits, that they weren't enacted. And we found, I think it was about half of that, 16% in the SSI side of the House. We made recommendations to SSA to automate that so that they could get the word out immediately. And one of the things that we found when we did the audit at that time is that many times once the disability review was done, it was put on a piece of paper, put on the front of the folder for that individual on it, and then when it got refiled or whatever it was, the termination notice slipped off, it was not found or whatever, and it never was enacted. So as a result of that, we told SSA that it would make much more sense to automate this so that when the person's turned off, when their record is pulled up, that it will show that they were declined, and that it would be done much more quickly. And at that, we recommended to SSA. It was part of our, they agreed with us on it, and they said that they'll implement it with resources allowing.
Has it been implemented?
And I think I'll turn to SSA on that one.
So there's a two-part process that we've undertaken.
Can I have you turn your microphone on?
My apologies. There's a two-part process that we've undertaken, and we appreciate the work that the Inspector General did. It was very helpful for us. And the first part of our process is that although the termination of a continuing disability review is not automated, we are doing what we call runs. So in other words, we go into the system annually and we look for those cases in the same way that the IG did when they identified the ones that weren't getting terminated. So we have been doing that now for a couple of years, and we will continue to do that to make sure that there are none slipping through the cracks. So that's part one. Part two, which is our longer-term plan, is to fully automate the process. It's a little bit more complicated than meets the eye, but we do intend to do that. In the meantime, we will do the annual run or the sweep to make sure we don't have cases falling through the cracks.
So if we're looking at about 16% are not actually being carried through, roughly, Mr. O'Carroll, is that 16% of the 500,000?
That's 16% of SSI.
Of SSI.
And the DI, the disability side, is a much higher percentage. It's almost 30% weren't.
Okay.
And that was also, too, is I got to say, not at all. It was, and I guess a delayed one, about 3 months at least.
Okay. Ms. Lankford, how much of, are you, when you're going through manually and doing this review, are you catching the 16% on SSI and the 30% on the disability? Are you catching all, I mean, the IG is saying that that's what they're seeing.
Yes, we didn't corroborate their numbers, because their numbers obviously were a sample that they took, and then they projected those numbers against the entire universe. We are not tracking the percentages per se, but we are making sure that we capture them. So we're using sampling criteria to look at any case where the DDS has or the ALJ has decided that that person is no longer disabled, and making sure that that decision is carried all the way through to our payment records in every case.
What's your projection for stage 2? How long is that going to take to implement, to go fully automated?
I'm very encouraged by the discussions that we've been having in the agency and our ability to do that. So while I don't have a timeline, I'm hopeful that it will not be far off.
5 years, 2 years, 10 years?
2 or less.
2 or less. Okay. Thank you. Mr. O'Carroll, in your testimony, you said that the IG has long placed a high priority on allegations of third-party facilitator fraud. What other initiatives are taking place to root out third-party facilitator fraud?
Congresswoman, that's sort of one of our thoughts when we came up with Puerto Rico and some other places on it, where it looked like outsiders were facilitating people getting onto the rolls. What we decided to do is to take our sort of a hybrid of what we use with our CDI units, where we have local law enforcement as well as our agents involved. And what we started to do is to start using automated records, going through, trying to look for any type of association, looking for the boilerplate diagnoses, other issues on it. We've got pilots going in the California region and the Chicago region right now. And what we're doing with it is that we're identifying anybody who is bringing large amounts of people onto the rolls, and making sure that all of their ways of doing it is legal, and that it's not bending the rules or whatever on it. So we've got a team, which we have an administrative law judge that's assigned from ODAR, working with our investigators on it, and we're trying to look for any anomalies in terms of people coming on. And I got to say, we've been doing that pilot for about 8 months now, and we've got about 4 different major investigations going because of it.
Thank you, Mr. Chairman. Out of time.
Thank you. Mr. Horsford, before I recognize you on that, just to let you know, when Mr. Horsford concludes, I'm going to open this up for a colloquy for all of us to be able to engage in the conversation with our witnesses. So we're going to shift from a 5-minute time period to just an open colloquy. So if you want to be able to remain and participate in that, you're obviously welcome to do that as well. Mr. Horsford, you're recognized for 5.
Thank you, Mr. Chairman, and I'd like to thank you for your opening comments to Mr. Sklar, that this is in no way personal, and actually, in fact, under his leadership, there have been major improvements on the administration side of the aisle, improvements that we need to keep making progress towards. But unfortunately, there also seems to be some misrepresentation of some of the facts that are being presented today. And so I want to kind of just allow the opportunity for some of our witnesses to bring forward all of the information that the committee should consider. Mr. Sklar and Judge, is it Beatty?
Bede.
Bede. Apologize for that.
Close enough.
Does the allowance rate of the judges, the majority identifies today, say anything conclusive about whether or not the judges correctly applied the law and agency guidance to the applications for disability benefits that came before them?
I'll take it first, and then I'll let Judge Bede jump in. I will say the allowance rate right now is probably at a 40-year historic low. So that's just an observation. And we've been very consistent in pushing the policy compliance message. I believe the judges are really responding well, not just to training, but to automated tools, to feedback. They've shown a willingness to listen, and I'm really impressed with the course. So, Judge Bede, other thoughts?
No, I would agree with that, and also indicate that the mere fact that there's a case has been seen twice by the state agencies and yet is reversed by an administrative law judge does not mean that either one of them was wrong. At the time the DDS, the Disability Determinations Service, ruled on the case, it may clearly have been that the claimant was not disabled. By the time it gets to an administrative law judge, time has passed, the record has been augmented, the claimant's condition may have deteriorated, and so what was once a clear affirmation that the claimant was not disabled becomes a clear reversal that the claimant is now disabled. So the figures themselves may lead you to feel that you have to look behind the facts, but they don't establish any correctness or incorrectness.
So the allowance rate alone doesn't say anything about the quality of the decisions. Is that a yes or no?
Absolutely. That's yes.
Would the gentleman yield for one moment? Would that include a judge that approves 99.4% of all cases? Because we have some judges like that as well. Should that raise a red flag?
It should raise a red flag, but it does not mean that any particular case was wrongly decided.
No, I do understand that on that, but there is some signal with that as well to say there may be an issue here at some point.
Oh, absolutely.
Okay, with that, I yield back. I apologize for jumping in.
So I think, though, the issue, though, Mr. Chairman, becomes the fact that we're not providing all of the cases, and it's my understanding that the Appeals Council's job is to actually perform the reviews of judges' decision and collects information on the quality of those decisions. Is that correct, Mr. Sklar?
Yes, that's correct. And just to provide a little bit of perspective, I know we spent a lot of time talking about fraud and anti-fraud measures this morning, but for perspective, it's important to recognize that the fraud incidence rate in this program is really quite low, typically less than 1%, and our overhead cost runs about 2%. So it is a well-run program. I know in any system you can always do better, and that's why we're here. We're glad the committee is having this hearing, and so we welcome the feedback.
Mr. Sklar, in the presentation of the charts earlier, did the majority ever ask you for statistics on the quality of judges, the decisions before they put up the chart on the allowance rate of certain judges?
I'm not aware of that particular request. No.
And so how is it then that we were able to then just see a certain select few decisions by judges rather than taking into account the decisions of a larger percentage that reflect all the work of the administration.
I think it's a fair point. Again, it's a very large core. There are over 1,500 judges, and I'm sure there are judges on the low end of the spectrum as well. We could have put up on the screen with allowance rates around 10%.
So can you provide that information to the committee? And Mr. Chairman, can we have as a part of this conversation, I know this is the second hearing that you've held on this issue, but I think it will be worthwhile for the committee to see both the high and the low range and the full scope, rather than just highlighting, 142, which represent about 10% of all the judges' decisions, rather than, the full scope and the range.
I would have no issue trying to provide that to both sides, and we try to be very fair to be able to provide everybody all the data on it. Our issue on it is there are truly disabled people that we're about 2.5 years away from insolvency in this program that can be hurt on this if we don't find a way to be able to resolve this issue soon. And I do not want the truly disabled to be hurt in this process, while some people, whatever small that number that may be that we are aware of, we're not catching. And in the ALJ process, if we're not able to do reviews, if there is a judge that's out there that is not held to account, and there's not a good process to hold someone to account in that, we need to find a way to do that. All of us have accountability, all of us. And so there should be clear lines of accountability that when there's a problem, we address it, whether it's low or high, either way.
Can I just ask a follow-up question? You referenced, Mr. Sklar, that the actual fraud rate is very low, less than actually the administrative costs, which is important to keep in mind. But is that fraud rate low in part because we don't have the resources to do the CDRs? And that's a question really to you and to Mr. O'Carroll.
I guess the first one, or the only thing that I always get put in the position on this when the agency says that it's less than 1% for the amount of fraud, is our concern on it is when you have billions of dollars going out every day, 1% is a very high number. And to any taxpayer, any dollar that's misspent is a high number to it. So our feeling on it is that, yes, we're taking a look at, when you take a look at improper payments and you go across the board for improper payments, the improper payment level for SSA is less than 1%. That's improper payments, and that's ones that shouldn't go out, and of that, a portion of it, or a large portion of it, is fraudulent, which is what we're taking a look at. And our feeling on it is any anti-fraud methods that you can be doing to discourage fraud are good. CDRs, as you brought up, is one. If we did more CDRs on it, it'd have two effects. One, we'd identify people that are being put on, or that are getting on the rolls that shouldn't be put on the rolls, which would identify the fraud. And the other part of the CDRs is a deterrent, just so that you know that when you are getting better, if it's a 50-50, whether you're going to come in and say that you're better and ask to be removed from it, it lets everybody know that the agency is going to be checking back to see if you got better. And I think that's something that we all hope for, is that we give you benefits and that you get better.
Just to clarify before I move to Ms. Lujan-Grisham, we are going to recognize you for 5 as well. The 1% number, that is improper payments. In other words, we sent a payment to someone that they either shouldn't have received that, or they're deceased now, or whatever it may be. That's not a statement of we have 1% of people that if we were to go out and test in the field with CDRs, we only have 1% of the folks that are receiving disability that shouldn't receive disability. Is that clear?
Correct, Chairman.
Okay.
So it could be higher.
Yes.
All right.
Okay. Ms. Lujan-Grisham.
Mr. Chairman, thank you very much, and panelists, thank you very much for being here today. And we all agree. We want a 0% if that would ever be a realistic number. We want there to be no bad actors, and we don't want any mistakes. We don't want constituents who are trying to receive disability benefits who don't qualify, and we don't want folks in the administration making mistakes. And anything that we do in this committee, and anything that you do that improves the opportunity opportunity for these programs is meaningful. And I appreciate the Chairman's statement that, we want to make sure that we do everything we can to have a benefits program that's available for future and current folks who are waiting for these disability benefits. But I would point out a couple of things. And one is that folks on disability, can be stabilized, we hope, and some things improve, but they're permanently disabled. They don't get better. It's kind of like the Medicaid program for persons with developmental disabilities, and across the country, we require a level of care review every year, and as far as I know, you cannot cure Down syndrome. So you have that every year, unless there was a pretty significant misdiagnosis early on. People live longer. These programs are going to be more and more expensive, and it is something that we are going to have to think about as future policymakers about what we spend, clearly, and how we do that, and what we can do to prevent disabilities and maybe get beyond a growth rate that we see in this country. And coming from a state where we have some of the highest disability populations, and just disabilities due to accidents from alcohol, significant issues that we could certainly as a state work harder to do a better job. And of course, I worry as much as anyone about the fact that not only do you take a long time, thank you for improving that to a year. In my poverty law days, it took 3 years to get somebody's disability application approved, and then I'd have to explain to them how they didn't get any health care benefits for 2 years but have been deemed disabled and sick. So it's still a tough, since the Medicare benefit is 24 months later after the disability determination. It's a program that's got some interesting, you get sicker before you get better, but then we're worried about how much money we're spending and what the efficacy is. And I could spend 3 more minutes before you ever get to anything about what you're doing currently about a program we just don't do these programs right. We're still learning how to make them fair and judicious and effective and keep out fraud on all ends for these programs. So I just wanted to say I appreciate those efforts. I think they're important, and like everybody here, I expect government programs to work, and I want to ferret out folks who are taking advantage at any level, both providers, judges in the administration, and constituents, and however they're taking advantage. Given that you've had lots of questions about the judges' actions and what you're doing in your quality review process, I want to talk a little bit more about the error rates. And I don't think, given what I've heard today or read, that the approval rates don't demonstrate whether the benefits are correctly or incorrectly denied. So it's my understanding then, Mr. Sklar, that the Division of Quality reviews a random sample then of the ALJ decisions to award benefits. Am I correct about that it's all random?
Yes.
And then based on that random review, how often do we identify that the benefits are incorrectly awarded?
Again, I could supply that information for the record. It's pretty technical, and I don't want to take you down the wrong path. But we are using that data to inform future policies and to give feedback to the judges. We give it to them in real time, and we're seeing significant behavioral changes on behalf of the judges.
I would really be interested, if it's all right with the committee and the chairman, that we continue to get that information, because then it really goes to, as you do those random reviews, you're seeing a change of behavior. I'd be interested in what that indicates, what we think that indicates, so that as we're looking at resources for the CDR and related programs, that there's a partnership about what really makes a difference, because as you then go to the appeals portion, how often then does the Appeals Council reverse those judges' decisions? Do we have that data?
So just one quick comment. There also is a second type of review done by the Division of Quality. We also do focus reviews. Those are after the money has gone out. They're closed case reviews. But in that instance, you actually can be a little bit more targeted. You can look at individual ALJs. You can look at individual hearing offices or representatives or combination of representatives and judges working together. Whatever you want to look at, you can look at, and we do pick areas where we think it will be productive.
That would be great. So, again, with the committee's approval, I'd love more information about the focus reviews. And instead of asking you, and this has been helpful, I also believe that there's a certain number of people who don't know that they should appeal. Poor advocacy advice, poor legal advice, disability prevents them. Yeah, particularly it's a mental health disability. can't get it done. Is there a process to take a look at how many people should have been approved those disability benefits but are never in a position to actually do the appeal?
From time to time, we do take a look at unappealed cases. We can try to get you whatever data we have that actually might fall more under the purview or policy folks as well. But we'll put together what we can on unappealed cases.
I would love that. I would love, frankly, I've only got a couple, in fact, I'm over, as much information about what we could do and how we could do this better so that folks get those benefits when they need them. We're spending less than on the care and services that they need, that income gives them an opportunity to access the healthcare system and related supports, including housing, as an example, and that this whole process is streamlined and effective so that we're making the best decisions about preserving it for future beneficiaries. Thank you, Mr. Chairman.
Thank you. And we will get
I yield back.
We will get into some of those conversations right after I recognize Mr. Walberg.
Thank you, Mr. Chairman, and thanks to the panel for being here. Sorry I missed much of it in another committee hearing, but I did have some questions, especially flowing from our last opportunity on this issue. Mr. O'Carroll, what are the actual savings, I'd be interested to know, associated with CDRs or redeterminations?
Congressman, what we found with CDRs, it's about a 9-to-1 return on investment and with the SSI or the redeterminations, it's about a 5-to-1. However, last year when we went back, and that's over
each dollar spent, there's $9 gained,
yeah,
or $5 gained in the case of.
Yes, Congressman. It's about, we figure it's about $1,000 to do a CDR, and then when you start taking a look at what for every CDR that a person is turned down or is off the rolls, it's a significant savings on it. So that's where we were figuring the 9-to-1. However, we went back, and that's over a long period of time. Last year, I guess in last year, we took a look at it again just to see in a one-year period what the return on investment of it was, and at that time went up to 13-to-1. So it's a very, very, cost-effective way of doing it is these CDRs. It's a good investment.
What recommendations then have been made, and what has SSA done to address the CDR backlog?
Well, our recommendations, and I'll let SSA answer what they've done on it, is our recommendation was to do more of them to reduce the backlog, because when you figure for every year that the backlog remains where it's at, it's over $1 billion that could have been saved by reducing the backlog on it. So we're telling SSA, one, to stay current, which would be not to increase the backlog on it, and they've been doing a fairly good job of staying current on it. So the backlog hasn't been growing. In fact, it was staying flat. Last year it went up a little bit. Went up about 100,000 last year on it. So our recommendation to SSA is to put more resources towards CDRs so that, one, they're staying current, and two, they reduce the backlog on it.
Do you feel they've been doing that, putting more resources to it?
I think they have been doing more on it. I don't know whether they've done, I think to my liking, they should be doing more. But I got to say is over the last few years that their integrity work that they have been doing is increasing. It's staying, as I said, current, which is very good, so the backlog hasn't grown. So one, I guess the best thing I can say is we encourage them to do more. We're asking probably also, too, is we're in agreement with them. If money is earmarked or designated in the appropriation to be done on the CDRs, they will do it. And whenever they are given extra money to do CDRs, they are done. So I guess the thing that you could take away from this is that we encourage an integrity fund be established that forces them to do CDRs. And that way, any other competing resource issues that they have won't reflect on it, and they will do the CDRs and do it.
Before I go to Mr. Sklar, how many taxpayer dollars would be saved per year if SSA performs CDRs on time?
Well, we're saying right now is between $1 to $2 billion is saved every year by reducing the CDRs and doing them all on time.
May I offer a number as well that might help to answer your question? And this was an answer to a question that Ranking Member Speer posed earlier in terms of the return on investment. So Mr. O'Carroll said that the return on investment is $9 saved for every $1 spent. And another number that you may find handy is that in this fiscal year, FY12, we're asking for $1.2 billion to be able to do CDRs. And if we get that money, we could do just over 1 million CDRs. And if you include the amount of Medicare and Medicaid savings that we would get if we spent that money, it would amount to $40 billion over 10 years in savings.
Okay, thank you. Mr. Sklar, will the agency prioritize erasing the 1.3 million backlog of CDRs?
Actually, I'll defer to my counterpart.
We share your interests in getting current with CDRs. We think it's one of the most critical responsibilities that we have.
With those type of dollars, I would hope so.
That's right. And we have shifted resources. To your question earlier about have we committed and have we made progress, in every year since 2007, with one small exception, we have increased both the number of medical CDRs and SSI non-medical redeterminations. Right now, we're at an all-time high. Over 1 million SSI non-disability redeterminations performed in the last fiscal year. So what we're asking for from the Congress is the adequate funding to be able to continue along those lines. And in terms of shifting resources, we have done that. I think this committee knows that we closed our field offices to the public 8 hours a week. We close at noon on Wednesdays. We close an hour earlier every day than we used to. And we did that specifically so that we could focus more attention on program integrity work instead of dealing directly with the public, taking claims.
Thank you.
For those that are here in the dais that have not been in one of these conversations before, what I'm going to do is I'm just going to open it up to open conversation, not do a limited 5-minute time period. We're going to try to run through a bunch of questions, and that allows interaction both here on the dais and with the witnesses as well. We have a lot of issues that I want to make sure that we get covered. It's sometimes difficult to do in a structured 5-minute time period. What we have talked about briefly as we started this hearing, and what I spoke with you about before the hearing started as well, is it's one thing to talk about the problems. We've got to talk about solutions. And so what I'd like to do is run through some of the things that have been proposed, either the IG has proposed, or we've heard from Senate committees, or other House committees here, or Mr. Sklar, you actually laid some of these things out in the past, and to be able to run through what are the ideas of how do we fix this, where do we go. And so I'd like to just start kind of peppering through this, and we're able to interact at any level. If you have another statement that you want to jump in on, we'll jump in as we go on it. Let me ask a first question on it. As far as limited dollars, more dollars should be invested in the CDR side of it or the CDI side of it, or is it just at both ends? Which one gets us a greater bang for the buck? Actually doing more investigation before they get in at the beginning, or more investigations once they're actually in the system?
Boy, that's a tough question on it. I got to say, on both of them, what we've asked for with the Integrity Fund is considering both of them, because also the other issue, what gets it a little more complicated is when CDIs are done, and if as a result of doing, I'm sorry, when a CDR is done, if as a result of it there's something either questionable, suspicious, or anything that needs some follow-up investigation on it, that's where the CDI units come in handy. And we found by working with judges in ODAR, if there's a question that comes up in an appeal, the CDI units are equipped to be able to go out and be able to validate or find more information on it. So I got to say, they're both linked very closely together, and if there was anything in terms of guidance from an Integrity Fund, I would like them both to be considered.
Is it the assumption you're talking about, the $1.2 billion is the assumption that is for both, or is that just CDR side?
That's strictly medical CDRs.
Okay.
So what's a CDI then?
A CDI unit is basically what we're taking a look on. Bottom line is it's about $100,000 per CDI unit.
Oh, wow.
And that's
and they'll do how many cases?
And of that, we have 26 CDI units in 21 states at the moment on it. We'd like to expand it into all the states. And what happens with that on it is the IG supports the investigator in it, SSA supports the location, as well as the local investigators on it, the DDS employees, and the MSS or Social Security employees. So most of the expense goes to SSA.
If I could just jump in on this too, I'm a bit of a compromised witness on this one, in that I helped set these up about 15 years ago. I think they're a tremendous value. They're front-end fraud detection. We've had a lot of discussions on the podium about how much do you get back after the money's gone out the door, and we all know not that much.
Right.
We do the best we can. We have collection tools, but ultimately you're getting pennies back on the dollar. You have to catch it at the front end. And it's the type of cases, the complex fraud conspiracies that Mr. O'Carroll's office has been working on and we try to support, that you can use a CDI unit to get at the front. So I would be a strong advocate. I've never understood why we don't have a CDI unit in every state.
Okay, well, how do we fix that? Because that does seem. Give me just a for instance here. When you've got a Judge Daughtry who is 99% approval, all the issues that come up, we've got to look at the focused review of the judge and how do we even get into this process. But a CDI should have caught this early on, or some kind of process to say we have a problem here. So it's either a focused review of the judges or it's some kind of investigation at the beginning of it to determine same doctors, same judge, same process, all run out of a few trailers in West Virginia. Is maybe there's a problem here? Yes, there is. And obviously the IG is able to identify that, start working the process. But that's part of what my question is. How do we get it on the front end?
Yeah, I mean, this is actually the infrastructure to get in on the front end. I've always been confused why we haven't been funded to have one in every state. I think it's very important.
Okay, but to that point, Mr. Bede, you're in charge in West Virginia, correct?
I am not currently involved in the operation of the Huntington, West Virginia office.
But you were?
I was until the Wall Street Journal article.
Okay. So in hindsight now, do you feel that there should be some role for a person like you in each office to review the work of judges to see if there's any kind of collaboration going on? Did you miss that?
Well, I'm not in West Virginia, and in the local office, there could be, if it becomes clear to other people, in this office, apparently one judge was doing this, and it was not, at least at first, clear to other people in the office. So if he isn't going to report it.
Well, he's clearly not going to report it, right?
Right.
I mean, he's part of the cabal.
Right. It makes it very difficult.
So,
but if we
is
had
everyone
a
so,
seat,
I guess I'm trying to understand, is everyone so autonomous that there's no oversight of any of these judges?
well, no, that's not the case. There is certainly oversight, but what we're saying is that we cannot tell a judge how to decide a case.
No, but we're not asking that.
No, I recognize that, but once it's decided, it falls into the purview of the Office of Appellate Operations. I don't have the staff well, I just don't have the staff to look at every judge's decision every day.
Do you have the authority to step in, though? If you have a suspicion that there's a problem, who has the authority to step in?
Yes, if I have a suspicion, or if a suspicion is raised that there are unsavory activities, then we would look at that, and we would probably refer it to the Inspector General's office, and obviously keep the Chief Judge's office and the Deputy Commissioner's office in the loop as well. And that's what we have done in other cases, and none of them as significant as this, but there have been other doctors who no longer have licenses.
Some of those things are really obvious.
Medical reports that are the same for 15
I mean, if someone's dead or someone doesn't have the ability to practice medicine anymore, those are gimmies. This is where there's a concerted effort, a cabal, to rig the system. So, Mr. O'Carroll, you have a comment to make here.
Thanks. One of the comments that I made amongst our own Office of Inspector General is I don't want to have to be reading about another hearing office or anything else in the newspaper on it. I'd rather us identify it in advance. And so as a result of that, we have a group working with Glenn Sklar's office on it, on trying to look for outliers or try to find, again, any type of connections between lawyers and judges or anything else where we're taking a look at doctor providers that are all doing this thing. So anyway, I got to assure you is that we're doing everything we can to be working with the Office of ODAR to identify any anomalies out there and try to stop them before they happen. And I got to say, Huntington got by us in regard to, there's a lot of issues on it that came out at the last hearing on it and different things about it, is that we're trying to find what went wrong and what we can use to identify it. That's why we have our pilot right now on disability fraud.
Right. Go ahead.
I'm sorry, if I may, just
go
one
ahead.
comment. And one thing that really is quite different, we have a very well-developed electronic record-keeping system now. We're collecting reams and reams of data, and in many ways I would call it big data at this point, where we're going in and looking for patterns and anomalies and really leveraging modern technologies. We have experienced programmatic people, economists, statisticians plowing through the data to try to find the next problem. So I think if you look back, Puerto Rico is a good example of where we caught it. 4.5 years ago, the employees in the Puerto Rico DDS found it, and they turned it over to Mr. O'Carroll's office. And
4 years ago, though.
well, it does take a really long time to put together a complex conspiracy case, and they had surveillance, and they needed to, there's a lot of work that needed to be done, and we actually supported them many steps of the way. But Huntington was a little bit different.
Well, how long has your big data been operational?
I'd say for the last 2 or 3 years, and quite frankly—
So you should have found Huntington. I guess I'm trying to, I'm not trying, no one's trying to beat anyone up here. We're trying to find out what we have to do to make sure that there aren't more Huntingtons in our future. And we do know one thing. If there is a void, people find a way to fill it. If there's a void in terms of finding the Huntingtons, there are going to be Huntingtons all over this country, because there just happen to be folks out there that are going to try to rip off the system. It's just reality. And, Mr. Chairman, I just asked my staff to research this, and I think this is very helpful to this discussion. When the Affordable Care Act passed, one of the things that was included in it was money for Medicare fraud over 10 years, $350 million over 10 years. So it's $35 million a year. In the 3 years that it's been operational, so a total of $100 million has been spent, they have already recovered $10.7 billion in fraud. So we know that those folks are out there, and they're going to prey on the Medicare system. They will prey on the Social Security disability system. They'll prey on any workers' comp systems in the state. They are professional rip-off artists, and it's our job to shut them down and be smarter than them in terms of shutting the door before they even get to open it. So you've got to provide us more kind of help in what we need to craft so that you can get your job done and so that we don't ever have to beat you up.
No, I fully agree on that. Let me walk through a couple of things as well, and other members feel free to be able to jump in on issues here. On the claimant representatives, the duty of candor, issue to clear regulations requiring claimant representatives to submit all relevant evidence in advance. Are we in agreement? I know you mentioned before on this, Mr. Sklar, that this is a pilot in some areas. How is that moving? Where do we go from here?
Things are moving pretty rapidly. We had a wonderful study done by the Administrative Conference in the United States. We took that study very seriously. We've had serious discussions back at Social Security. And I can't say very much about it, but let's just say something has moved from Social Security to the Office of Management and Budget in that regard.
Okay. Is that something we can talk about more offline?
Yes.
Okay.
Could I just jump in on that same issue of duty of candor? Who represents the taxpayer in the hearing process? As I understand it, both sides aren't represented.
Well,
who represents the taxpayer?
as an administrative law judge, there is a duty to represent, to protect the taxpayer as well as to ensure that the claimant gets a fair hearing. And all of our administrative law judges are aware of that and take it very seriously, possibly with the exception of a few judges who allow all of their cases. But it is part of the job of the administrative law judge to ensure that benefits are not awarded frivolously and that the government is, the trust fund is protected.
But it seems to me, and advise me if I'm off base, but if the hearings are non-adversarial, why does only one side have representation? Are we missing something, especially when we're talking about the load, the backlog, and all the rest that goes on? Are we missing something in not having direct representation for both sides?
I personally don't think that having the government represented would add a lot to the process. I don't know, Commissioner Sklar?
If I could just chime in really quickly on the history, this program was set up quite some time ago as a non-adversarial program, and it's been enshrined in Supreme Court case law as such. We did try a brief foray in the 1980s with a government rep project, and were ultimately shut down by a combination of the federal courts and outrage in Congress. Since that time, we have made a lot of changes. We've actually beefed up the staffing behind the judges. For example, we do have clerks that marshal the evidence and exhibit the file and get everything ready. We do have decision writers behind the ALJs. We have senior attorneys they can turn to if they have a tough policy decision and they want to work up the file. So it's not just the ALJ by himself or herself anymore. There's literally 4 or 5 people standing behind every administrative law judge.
Can I ask a question on that specifically? Are those, all those support folks around there, are they assigned to a specific judge, or they're still working with the pool? Because part of the conversation we had with the judges was they didn't know which technical person was going to be assigned to them. Just that relationship between the judge and their assistant doesn't seem to actually happen in this particular setting. And I know there's some issues we talked about before, them being union and supervising and all those kind of dynamics. But is there a need to get decision writers and technicians assigned to specific ALJs so that they form that rhythm and know what's going on? Or is it your opinion that that should not happen? It should continue to be a pool?
Actually, it's somewhat interesting. We have both models running right now.
Okay.
In the traditional hearing office model, it is a pool model. And for various reasons you've mentioned previously, they don't directly supervise the staff. On the other hand, we have the national hearing centers. There are 5 of them nationally. They're all video units. They do only video cases, and they supervise their law clerks. And quite frankly, the judges love the model, and the law clerks really seem to like the model a lot. So it's something.
Is that something that can be multiplied out? That's you're finding efficiency in, or just preference?
Again, it's something that certainly could be expanded, and we've looked at, but we do run into labor issues with that as well.
Mr. Chairman, I wanted to add on to this. I'm a little confused because I want to make sure that that I have a better understanding on what resources you need. Some of these things seems like these are models and pilots you're putting into place so that you have the capability to do it. And then there are some issues that have to do with funding as a resource, which is the 2014 budget, looking at the money so that you can do the CDRs, over 1.2 million CDRs. Are there other things that you need from us to help you? For example, Mr. O'Carroll, you talked about the MERS, the Medical Improvement Review Standards, and how someone who is incorrectly put onto has been determined as being disabled, actually SSA has a hard time taking them off the rolls because those standards are there. Is that fix a legislative fix, or is that an SSA fix?
Well, that one would be, I guess, a little bit of both. One is that by law, once they've been found, as disabled on it, it's impossible to go back and review it again, which is the whole issue of the improvement on it. If it was incorrectly diagnosed, there's no way you're going to be able to show improvement. So that's a little bit, one, by law, they're entitled to it, and 2 is by SSA, instructions. I'd let the agency answer that one a little bit
So if one
better.
of these doctors that's collaborating says that this person is disabled, but they're not disabled and they're put onto the rolls, we don't have a way to take them off, or MERS makes it that much more difficult to take them off?
We can take them off if the exception on it is fraud. And if we can show there was fraud in the fact that they were put on it, yes, we can take them off. Good example on that was in Puerto Rico. We've identified 71 people that doctors have put on erroneously on it. We can take them off, and did take them off immediately, because it was fraud involved.
But incompetence is not an excuse.
No.
Okay, Ms. Lankford.
And the other one, though, again, I guess on this one here, while we're talking, is that you were asking what resources are necessary. Yeah. I just want to go on record here is that, one, we talked about the CDI units and how effective they are and the return on investment on it. And I agree, and that's very, very important. Another one that I got to say is that, in our case here, we've got, our auditors, as we saw with all this information that we've been able to give you in terms of the medical improvements and the CDRs, et cetera, is because of our audit work. And then in terms of trying to prevent anything, as an example of, Puerto Rico or any places where there's a systemic attack against SSA, our investigators are there doing whatever they can. But I got to tell you, our resources are very limited. Over the last few years, we've had about a 10% reduction in staff, simply because we've stated a level funding on it as every cost goes up. 90% of my costs are really just on salary and office, brick and mortar. So all I can do really is just keep subtracting staff in order to make our bills. So anyway, when you're asking what you could do to help us, is one of those things is for us to be able to get a set budget where we can, be able to at least go back up to our allotment of investigators and auditors to be able to look into stuff like this.
Ms. Nankafora, you wanted to say something?
I just want to take a very quick opportunity to attempt also to answer the question about what you can do for us, because I think it's twofold. One is adequate and sustained funding, not just the program integrity funding to do the CDRs, but adequate and sustained funding for the entire administrative budget. We have been operating for the past 3 years $1 billion below the President's budget request. Since 2010, we have lost 12,000 employees across the Social Security Administration, making it increasingly difficult for us to just do the basic work that we're tasked to do, let alone trying to solve some of the more systemic problems. And number two, I'd just like to encourage the committee to continue highlighting the issues you've been highlighting, because I can speak from a policy standpoint. We have a lot of irons in the fire, so to speak. We have a lot of areas in the policy realm where we're looking to improve upon current processes. And we can talk about some of those, but I think it's, to the credit of the committee that you've prompted us to continue to think about these things and work hard to, fill gaps where they exist.
What about the appeal of a decision by the ALJ? The only appeal right now is an automatic appeal if it's denied. What happens? On the one hand, Mr. Bede says, well, the ALJ is representing the taxpayer and the injured worker, or the injured individual, but I don't think you can represent both sides adequately, frankly. I think that's a mischaracterization of what an ALJ can really do. So there is no appeal process. The question is, should there be on behalf of the taxpayer?
So just to clarify, with the new Division of Quality, we do look at roughly 5,000 to 7,000 unappealed, fully favorable cases each year, and that's new, and that adds some balance. We were looking at hundreds of thousands of denials. There were appeals from people who lost, but on the cases that were paid, nobody was looking at those cases in any systematic way in a large number. So now we're doing that. It's a statistically valid sample that can help us drive policy changes. We also feed back the data to the individual judges. But to be clear, it's still only 5,000 to 7,000 cases when we're running an operation that's moving 800,000 cases annually. So,
and just by doing that doesn't mean that that individual doesn't get the benefits either.
Well, actually, sometimes their lawyers are very upset because, yes, you would indeed intercept the benefits in those live cases.
You do?
Yes, yes. So that authority exists, but we're only funded to do a certain number of these items, or we can only afford to do a certain number of these cases.
So of the 5,000 to 7,000 cases that you have intercepted, so to speak, how many of them were the benefits actually not provided in the end?
I can supply that for the record, for sure. We have that data.
Can I ask how you picked that 5,000 to 7,000? Was it just a random sampling, or were you targeting certain areas?
So that's a really good question, because under a 1998 regulation, we are not allowed to target. And we are now not allowed to target judges. We're not allowed to target hearing offices.
So let me review. Huntington, West Virginia, when that's happening and you see these very high numbers, you're not allowed to go back in and targeted review on that.
That's exactly right, not on live cases. And
we got to fix that.
And to be clear, we did sample some of those cases, but it was a relatively small sample. And they began to ask the right questions. If they were looking at dozens of these cases, I'm pretty confident they would have gotten to the right place.
So your hands are actually tied.
To a certain extent. I just want to be abundantly clear, though. We can look at closed cases anytime we want, but then the money's gone. So you can look at closed cases for any reason. You can target cases where a judge has paid at exorbitantly high levels, low levels, where they've put out huge number of dispositions, tiny numbers of dispositions. You can target for any number of factors, but you cannot do it on live cases pursuant to a regulation that's been in place since the late 1990s.
So to that point, if you're doing all this data collection now that's much more sophisticated and you can see trends, then to not be able then to drill down is counterintuitive.
I just want to be precise, though. We can drill down on cases where the money has gone out the door, closed cases. We cannot drill down on live cases before the money goes out.
What about targeted reviews of an ALJ or of a group of ALJs, or questions on that? What can be done on that, and what is being done on that?
We do focus reviews. Again, they're on closed cases where the money has gone out the door already, but that is helpful at times. You can see what's happening. We'll typically feed that back to the line managers if there's a problem, and they'll have those conversations.
And is there a way to be able to discipline a judge or to be able to confront them and to say this is it? Or it has the appearance, at least, of several years ago that when judges were high producing, they were sent more cases. That seemed to affirm them to say, okay, you're reversing a lot of cases, you're dealing with a lot of cases, let's send you more. That's not true anymore, it appears.
Correct.
And grateful for that. But how do we handle this as far as when we see there is an issue, some sort of discipline so that there is that accountability that's built into it?
Yeah, first we're going to try with voluntary compliance. We're going to give them a chance to get better, and most do. And most are very agreeable. They're surprised. They've been doing this for 20 years and nobody's given them feedback, so we're happy to give them that feedback. We actually set up a tool called How Am I Doing? It's an electronic tool. They can actually look at their remands coming back. So we think that is helping to change behavior. But in instances where folks refuse to comply, and occasionally you'll actually have an ALJ who says, I refuse to follow the policy, then you're into a whole other realm. And there are procedures for conduct and performance violations, and we do use those procedures, but they do take a long time.
How often?
In my written testimony, I've talked about 20 cases where a judge has either been terminated or left voluntarily.
Okay. We mentioned before as well the CDR review and going through the process of that. There was a term that I discovered I was not familiar with, but the more that I read and the more people I talked to in different parts of the country and DDS offices and such, I heard this term for CDRs that was used behind the scenes of not then, not now. I don't know if you've heard that before, but it's the perception of they weren't disabled before, they're still not disabled now, but there's nothing we can do about it because we can't show that they've had medical improvement because they really shouldn't have been disabled in the first place, and now we're stuck. It seems like there's a standard to get on disability that they can't have any involvement in any vocation in the United States right now, that they can't significantly function in our economy. If they somehow get past that, then there's a different standard to if they have medical improvement or not. Am I reading that correctly? That there's once you're in it, it's medical improvement, not whether you can engage in the economy, but going into it, there's a standard that you have to be able to engage in the economy?
You have summarized that pretty well. And so this is one of the issues that we're looking at really closely because the law does require that a person show medical improvement in order for us to terminate benefits. So there is, though, one exception to that, the exception that Mr. O'Carroll mentioned if it's clearly fraud. But in addition to that, there's what we call the error exception, which is if we believe that an error was made initially, not necessarily fraudulent behavior, but it was just a bad decision, we do have the legal authority to go back and revisit that decision and terminate benefits. Now, what you're hearing when you go around the country is the fact that adjudicators are not really doing that often. It's a very infrequently used provision. And what we're doing now is we're taking a sample of cases and we're doing a comprehensive review to try to understand why it's not being used. Is it a training issue? Is it a clarity of policy issue? Do we need to amend the regulations so that they give more teeth, let's say, to the process? We're not entirely sure how to make better use of that error exception, but we think we do need to do that. So the comprehensive case review we have underway now will help us to inform our next steps in terms of whether we need to go the rulemaking process, the training route, or a combination of those.
But you have the authority right now to do that. As far as the error possibility to say, we believe there was an error made in a previous case, you already have that authority. That's not something you need from us.
We do, but understand that it's quite complicated, and we can't, for example, substitute judgment. Okay? The regulations are very clear on that, so you can't say, oh, gee, I just think Judge B did a bad job, and I'm going to substitute my judgment for his. So one of the reasons I think that adjudicators are reluctant to use it is because it's a very complicated rubric that you have to go through in order to use the error exception.
So what would you recommend then?
So again, we're doing a comprehensive case review because we want to look at real cases and figure out where we should have used this exception, why we didn't, and then we're going to move toward probably a multi-pronged approach, but we may need to amend our regulations to make them more clear so that adjudicators can use them more readily.
I guess what I'm asking, though, it sounds like the error exception is not being used. You're going to review that and see why it's not being used, but the truth is it's not being used. So if that's the case, then we need to provide you with a tool that allows you to more simply and easily address cases where they should never receive the benefit in the first place?
I'm not saying that at this point we need legislative change. I think we may be able to make better use of the error exception through our regulatory process.
Okay.
If I could bring a little bit of light on something we're trying to do at both the DDS level and at the hearings level. We are trying to get our adjudicators to better rationalize, memorialize, and explain why they allowed somebody. And that's really, really important, because without a really good rationale, it becomes almost impossible when a CDR comes up to take that person off the rolls if indeed they've shown medical improvement, because you're going against nothing. You have to show medical improvement from a certain baseline. So we've done a couple things in this regard. We've introduced an electronic tool, the electronic case analysis tool, at the DDS level, the state agency level, where they actually have to memorialize and rationalize their decisions. And quite frankly, I think it's been exceptionally helpful, both in the CDR realm and even more helpful for the judges, because now the judges know why a case was denied at the lower level. So if you ask me, well, one of the reasons why the allowance rate is going down at the hearings level, I think they're actually looking at why the DDS denied the case. There's now a rationale, and pretty thoughtfully done. We're actually trying to get the judges a similar type of tool, an electronic bench book, so that they have a policy-compliant electronic tool to rationalize, memorialize their case as well. Of course, they have decision writers, but we think it's really nice if they can get some of the work and some of the policy-compliant instructions to the writers in this tool.
In the West Virginia case, without harming the actual case itself, was the bench in that West Virginia city, Huntington, I guess it is, did any of them come forward? I mean, do judges know about the work of other judges?
That's a tough one that I got to be really cautious on, because it's an open investigation. So I can't really talk in terms of the witnesses on it, but I got to say there was a culture in that office that became pretty apparent in terms of a number of people in it raised concerns over time, and a lot of alarm bells had gone off and just weren't addressed.
So why didn't any of them become whistleblowers? Or, I mean, is there a bounty hunting opportunity for people that come forward in a situation like that? I mean, it sounds like there were people that recognized there was a problem, and then the management declined. And those are my words, not yours, so I'm not putting them in your mouth. But it seems like I'm a big believer in allowing whistleblowers protection and compensation when they come forward.
We agree completely on that. In fact, one of my jobs as the Inspector General is the protection of whistleblowers, to encourage them to come forward, to protect them after they do come forward, and if there is any form of retaliation, to to prosecute management for doing it. So, yes, we send the signal out there with for whistleblowers to come forward. We will protect them, and there has been examples of it. I guess the other, as it becomes apparent with any of these, situations on it is that in retrospect, when you're looking back on it, you're seeing a lot of, signals that should have been should have been addressed, where people came forward with issues. I got to say, when we look back on it, they're not always, even though you're a whistleblower and you're complaining, it may not be as specific as we wanted. And what we found is a lot of times there's inter-office issues that are going on with their time and attendance, and it's not necessarily fraud or some issue like that. So that's where they get overlooked. And that's why we're trying now to, send the signal out there, as if there is an issue on it, bring it forward, and we will investigate it.
Just one quick comment, too. My personal opinion, the best line of defense is your front line. And we've really spent an inordinate amount of time trying to reaffirm the need to speak up. And having spent 8 years in the Inspector General's office before taking this job, I've really been very active in that regard, and we've seen our referrals to Mr. O'Carroll's office shoot up quite dramatically. So I do think a lot of it is messaging. I do think a lot of it is making it safe for your employees to come forward and feel like they won't get in trouble, they won't get second-guessed. And we really put a premium on making sure that if any hint of retaliation or reprisal, that's not okay.
Are they eligible for the award system that exists in the Federal Government when you call attention to a cost or a savings?
Yes, they are.
Good. Let me ask Mr. Sklar something that's not politically challenging or difficult. Let's do something simple like revising the grid. So the grid, my understanding was several years ago, tried to go through revision, and members of Congress and multiple outside special interest groups screamed so loud about it that the whole thing was scuttled. And we're still stuck with a grid from the 1970s, where it talks about elevator operators and such as, meaningful jobs that are out there, and more sedentary jobs like computers, that is the top area for the jobs now, are not listed on there because it just wasn't a major job during that time period. Age issues, everything else becomes a big issue. How do we do this? We talked about it a little bit before about getting a study on this and getting going. How do we get this fixed?
Okay, so great question and a fair characterization of the situation. We have two separate work efforts related underway. One is that we are updating right now the Dictionary of Occupational Titles, which is that book with the 12,000 jobs in it that you referenced. It hasn't been updated for decades. We have a contract right now with the Bureau of Labor Statistics, an interagency agreement, and we have a great relationship with them. It's been in place since 2010. We've already done 3 phases of data collection out across the country using field economists that go into real businesses and collect data about how jobs are done across the country. So that process is moving along. It's a multi-year initiative because it's very complicated. The book that we end up with has to be legally defensible.
Done when? When's your target date for completion?
2016 is our hope.
Just in time for a new president to scuttle it, but that's a whole different issue. So,
but understand, for the undertaking, the time frame is very quick. It really is, and that's a target.
But then it's still got to go through all the rulemaking and all the fight and everything else, or you're thinking complete by then.
We are hoping for something usable. It might be a phased rollout, a phased implementation, but we are not even sure we're going to need to modify regulations. I mean, I can't make any promises, but we're trying to update it in a way that it doesn't require dramatic redesign of program rules.
Okay, so that's one aspect of the employment side, but we still got age, we still got everything else.
Okay, so the other stuff, which really falls into the category of the grid, okay, which is, I look at it as a chart that you use where you incorporate the factors that we're statutorily required to consider: age, education, residual functional capacity, which is the ability to do work. We take those factors into consideration, and the interplay of those factors are considered, and then we basically use this grid or this chart to determine then what your finding of disability is, disabled or not. And you're right that we haven't updated that in a long time. Right now, we're taking a very careful look at that, because the reason we were unsuccessful in the past is because the changes that we made were not evidence-based. And that's what we learned from that experience, that in order to make a change to the disability programs, which are going to have rippling effects for millions of people's lives and potentially have, billions of dollars of implications one way or another, it's got to be evidence-based, it's got to be sound. So what we're doing now is we're revisiting the grid issue, and we're working with the Disability Research Consortium. And this is a group of highly skilled economists around the country that are working with us to look at those factors that we have to statutorily consider: age, education, work experience, and how other disability systems use those factors in the government and outside of the government. And they're going to give us some sort of an environmental scan and some advice on how we might want to change our rules. So by getting that evidence base or that research base beneath us, we think we will be much better positioned to make sound changes in the grid rules.
And what's your timing on that part of it?
The Disability Research Consortium work should be finished in the middle of FY14, June or July of FY14, and then depending on what they come back with, we will be shaping our next steps.
So we're talking about the middle of next year. We'll have some sort of proposal that's out there, and then it's a matter of a couple of years to get it out, or you've got data in from them by the middle of next year, and then it's to start putting the proposal together.
So we have data, but we are simultaneously, we know where the vulnerabilities are, so we're trying to simultaneously work with the Disability Research Consortium and in-house to be prepared to do what I think will end up being rulemaking, hopefully in FY14.
Under 18 and over 18 at the same time, or just all adult focused?
We're right now focused on adults.
Okay.
Can we talk about the under 18 group? Because I've never seen them actually defined that way before. And I would just like to understand it better. Why are persons under the age of 18 eligible for disability benefits when they probably haven't worked 40 quarters for starters, right?
So we're talking about the two different programs that you mentioned in some of the opening remarks. The Social Security Disability Insurance Program is the insurance program for those people who have worked and earned sufficient quarters of coverage to get benefits. The program under which disabled children become entitled is the SSI, or the Supplemental Security Income Program, which is a needs-based program for disabled children and doesn't require any work having been done.
Are there any problems in that program?
Yes.
Well, let me just say, we think that there's always room for improvement, for sure. And we have a partnership right now with the Institute of Medicine, and they're looking very carefully at our childhood disability program. We actually have a consensus committee that they have put together with medical experts that are going to help us take a really close look at the SSI childhood program and identify ways for improvement.
Mr. O'Carroll?
Yeah, one of the things, in fact, I was thinking about it before when we were talking about overpayments, and I was talking about the overpayment being in the 1% range. That was in relation to the disability side of SSA. In relation to the SSI side, just as the Chairman just echoed, in terms of the issues with SSI are much higher. That's in about the 6% range on it, and a lot of that's because it's self-reported income on the people that are benefits for it, as Ms. Lankafour just explained, is that it's a needs-based program, and a lot of times, you know, it's based on what a person says what their income is whether or not they're eligible for the program. And what we're finding now along those lines is, and I applaud SSA for doing it, is there's a lot of electronic financial information out there that can be used to run people against, to see when they're claiming that they're indigent, to see if they do have resources. And SSA has been making great strides in terms of using financial intelligence to be able to identify people on it. But the SSI program does have a much higher overpayment rate.
But for the disabled children, is there?
And the children part of it is one of those, because what happens with the children is oftentimes with children, they do improve, you know, in terms of their own medical information on it. And we're asking SSA to do more continual or redeterminations on children. And then again, at age 18, that's before they get into the adult portion of it, they're mandated to be doing redeterminations on those to decide before they become an adult whether they're going to be on the benefits for the rest of their life. And that's an important one, and that's oftentimes neglected.
Yeah, this is my big issue with when we have anything that smacks towards an error or fraud in SSI. We have a child, 10, 11 years old, that is labeled as disabled. If the redetermination process doesn't go well, they carry over into adulthood, all the potential of that kid is sapped away. They're told from when they're 10 years old, you're disabled, you cannot, and are set aside. I ran into a young man about 2 years ago in his early 20s that had Social Security questions for me, and I asked him why he's asking me. It's very unusual for someone in their 20s to ask me about Social Security, and I just asked him flat out if he was on SSDI. And he hesitated and said yes. And I said, may I ask what for? Because I had this great conversation. We're in this large event. He'd been socializing with other people. And he said, well, I'm ADHD. And my first thought was, and I said to him, we need to help you get a job because we're losing you. We're losing all that you could produce and all that you could do. So the questions that I have on this is when I went and pulled the under 18 numbers and I see the rise in two different areas. Number one being ADHD. Number two being speech-language pathology and speech-language delay, as far as the top two reasons that are rising for those. Both of those, there are a lot of issues and questions about how long. For instance, ADHD, is that they qualify without medication or they qualify with? Because if someone has medication on it and they meet these different markers without, but they go on medication, obviously, often they're very functional in a social environment and very engaged. But if they're off that medication, they're not.
Mr. Chairman,
do we know how that is done?
Yes.
I have personal experience with ADHD with a child, and I think that this would be ripe for a hearing on just looking at children under the age of 18 who are eligible for SSI because of ADHD. And let's really drill down on this. I'm stunned to hear this.
Right.
really stunned.
Can you give us just an answer whether it's before or after medication for that?
Sure. So we require that anybody, whether it's ADHD or any other course of any other disabling impairment, that the individual comply with the course of treatment that the physician is prescribing. If they are not complying with a course of treatment and therefore the condition is deteriorating, then that's grounds for us to deny the claim. I would also add—
But I'm saying, do they meet the standard, the criteria that's being set after medication or before medication?
after compliance with a course of treatment.
So sometimes it's behavioral, sometimes it's pharmaceutical drugs that are prescribed. So they have many different.
In these cases, there's also the issue of obviously SSI people are low income, and there may be no treatment because there's none available to the child.
Well, there should be now under the Affordable Care Act.
Yes, under the Affordable Care Act there is now. But in the past, they would be put on benefits and would then be entitled to Medicaid. They would get treatment and they would improve. And
then
leave the rolls, they would lose their medical care and would deteriorate. And we would see that on, not a lot, but we would see that occasionally. So it was
Same thing for speech delay, because when you get into speech delay or articulation issues, I mean, that becomes a socialization issue on it, but to have a child that has a difficult time with articulation or a delay in articulation, that's a completely different issue. And to see the rise of the speech language, now language is a different issue because that's mental processing, but the speech side of it was a little bit of a surprise to me.
And is also very often responds to speech therapy. But personally, I have not seen a lot of those cases. I take your word that they show up in the statistics, and I don't know whether they're allowed at the state agency level or at the hearing level, but I have not noticed a significant problem with allowing children with developmental delays.
Mr. O'Carroll, have you looked at this issue at all, and is it more prevalent in some states than others?
I'll tell you, we haven't done work on it. It's on our work plan to be looking at it. Amongst other things, there was a large, I guess, regional concern on it in, I think, the Massachusetts, where it got a lot of media attention and everything else within the last year. So it's on our radar screen as, as an issue to be taking a look at, but we haven't done any work.
May I just also add, I just want to reiterate very briefly, we are right now under contract with the Institute of Medicine, the National Academies of Science. They are sort of the premier authority in this area, and they are looking very specifically at the childhood program and some of these issues, and that is underway as we speak and will be done in 1 year.
Right. So we're 1 year away from that one. Is that 1 year away from data or from a proposal?
From their recommendations to us.
Okay. I know we're hitting the noon hour here, and I'm very aware of everyone's stomach and that y'all have been seated for 2 hours. I'm very aware of that. I want to be able to honor it. What I'd like to do on it, do you have additional questions or comments on it? What I'd like to be able to do is follow up with Mr. Sklar if we can. Maybe Mr. O'Carroll can join us on this. We'll have to just see on the timing on it, and whoever you'd like to invite to be able to join it. I have a long list of all the reforms that have been laid out and the ideas that are out there. What I'd like to do is try to figure out what are the things that y'all are already working on, as have already been mentioned. This is already in process. What's our time period for completion on these? What is the legislative need that the ranking member and I need to work on to say where do we need to push on this, whether that be funding, whether that be a change in the law or the statute? What is it that is needed from you to be able to make progress on this? And then what of it is management related, quite frankly? To say where is it you need greater oversight or a push to say if there's an anomaly out there, how do we deal with that? So if there's an obvious, you look after the fact at Huntington, West Virginia, and say, okay, it's obvious once you look at it after the fact, how do we get some of those things to ping up earlier and get some of the review process to be able to come through? As Mr. O'Carroll's already said, we never want it to happen again. But we're going to have people that are trying to run the system on it. It did not take us but a moment to sit down on a computer and just to type in Social Security disability, and what came up first was an ocean of law firms telling you how to game the system. If you'll use this term, this is what you need to submit into it. That becomes the first thing that you get when you search on Social Security disability. You have people after you that are trying to game the system, that is their bread and butter to do it. We need to help protect in any way that we can to help guard the taxpayer and individuals, and most importantly in this process, those vulnerable, disabled individuals that will take a hit 2.5 years from now and will have even more instability in their life if we don't do something for this. So I appreciate your work on it, but I'd like to have some offline conversations on some of these to see if we can't form a list of to-dos where we can do what you can do, and I'll find out what you're already on. Is that fair? Other questions or comments you'd like to make?
Mr. Chairman, let me just say this has been, I think, one of our best hearings, and we can really work together to make the system work better, and that's really our charge to do that. And I think it's very clear that unless we have more money to do these CDRs and to fund Mr. O'Carroll's operation, we're not going to succeed. So it's really important for us to do the responsible thing here, and I will work hand in glove with you to make it accountable, but also to give them the resources so they can make sure the right people are getting these benefits. Thank you.
Thank you for your time and for being here today. We'll follow up and continue on through the process and see what we can do. This hearing is adjourned.